speaking. Let me first thank you for the invitation. Let me secondly thank Andy for his excellent comments, because it's truly the essence of what you just outlined by coming to the experience with India. That first, we all, in using your analogy, Andy, we play the same ball. There is not an Indian ball game, there is not a Chinese ball game or a European ball game. It's the same ball game for all of us in healthcare. The question we have to ask ourselves, what is the ball that we are playing? And I think here we should look at India and the experiences that we made in India as Evotec, which is the company that I work for, as one company which has a history with India, because we had a presence in the year 2010, 11, and 12 in India with about 200 chemists. And then we basically went out of India. And that's probably also the reason why I was invited to this discussion here. I say this as Evotec, and I want to introduce the organization to you because we are not as a global pharma company known as many as the other panelists on this event. We're an organization of about 4,000 scientists with more than 2,000 PhDs globally working in a drug discovery and drug development platform organization that is working at every moment in time for more than 500 partners in the biopharma industry. So we truly represent the sharing economy in the biopharma industry by basically sharing platforms with many companies. So our experience in India, which I think is very insightful from the year 2010, 11, 12, was that even when a company has access to excellent talent and to a lot of talent, it doesn't help a company if the technology that we have to apply in drug discovery and drug development is moving faster than people alone can move. So what we decided in the years about a decade ago is to really put all our efforts into the technologies that change the way we think about drug discovery and drug development. What do I mean with this? We focused all our technologies on early human relevant disease readouts. And from there on, prediction technologies to combine machine learning, artificial intelligence into the experimental cascade as early as possible and as efficiently as possible. And with this, we found that we have to put all our bets into the technology evolution and not only into having access to cost-efficient labor. And I think that's one experience that we should draw on for the future, that it's an innovation game, it's not a lower cost game that India should apply. The second experience that we made is that early drug discovery and early development is very often a game where we think that we are working on the right assets, but at the end we still fail. So that's the big question of translatability. And the big question of translatability in data looks that way, that more than 70% of all academic and early biotech data that is generated today cannot be translated into an industrial process. So there's a lot of waste that happens because the right experiments are not done, or because for cultural reasons, we don't allow ourselves to say that an experiment doesn't work. And with this, I think one experience is that we have to create a culture to make early stop losses for projects that don't work, and have to really get this as an integrated understanding of our scientists in the works. The third element as an experience that we want to draw on is that it is only if you have an integrated interplay between talent, financing, academia, and an industrial translational culture that a biotech ecosystem can work. So here we have to bring the fragmented structure of India closer together, and I think here new data tools are a good way to do this, and combine this not only with an organizational format for these companies, but also with an exit structure for these companies. One of the big successes for China and the US in the last 20 years was that you had always additional financing sources and a capital market available for companies that got started. And here, Europe fell behind. And here also, I think India has to catch up to other areas. So when you take all these experiences together, you can come to a few very clear learnings. One learning is that you have to allow the latest technologies to be accessed, and they can be accessed on a global level. So that's why I think partnering structures from Indian companies with global platforms who, for example, are leading machine learning, are leading induced pluripotent stem cell technologies, are leading transcriptomics, metabolomics, early readouts, would help a lot, because building this only internally takes a long time, and there you will fall behind. The second learning is that many of the medicines of the future will be defined in products where the product is the process. And when Andy before said that there's a lot of innovation ongoing in cell and gene therapy, the big difference to cell therapy, gene therapy, and modern biologics is that the product is the process from the very beginning. So that's why an Indian ecosystem can not only start later in the value chain as clinical organizations or as CROs, you either are at the beginning of the value chain, and with this you have the product understood as the process, or you will completely miss out on these innovations. So also here, I think you have to start to understand that early collaboration globally is helping you to come to the starting points here. And with this, if you go down the path and say that we have an experience in India that technology is moving faster and more impactful than just, quote unquote, having more talent available, I think we already have a very clear strategic starting point that was an experience that Evotecs made, but I think that can be applied to many others. The second is, and it was already said, the sharing economy for research and development is not a national, it's a global economy. And therefore, we have to find here ways to collaborate on technologies from India to the world and from the world to India, much better than we did this in the past, to accelerate and overtake in certain processes out of India. Machine learning and drug discovery will change the way we think about the future of products dramatically, because human genetics will define personalized medicine in a way that we have never thought about this before. And that's why the earlier the Indian ecosystems understand that prediction technologies for personalized medicine have to be the future in all processes, I think the faster we are then putting our dollars behind the right technologies and the right products. So the tools that can be applied are new, and that's why developing all these tools internally in India alone, I think, is not efficient. We should really find here ways to cooperate globally. Evotecs does this with 60 academic institutions globally. We have academic networks that we then translate into pharma processes. And I think here the basic academic setting in India is very good. But we very often come, as everywhere on the planet, to this point that we say it doesn't help to have only good academia. It really only helps if we have good translation. And that's only working if you bring this sharing economy principle together, because otherwise you are always creating a bias from one organization to a second organization. Only if you have here a platform where all technologies meet and where the dialogue is happening on a global winning level, then I think India will make a leapfrog very fast, and with this also leverage the academic experience that you have into drug discovery processes. Let me end by saying it is an amazing opportunity that India has, because the talent pool is excellently trained, it's excellently motivated, and the global market that you can open is endless, because there are 3,300 diseases that are still waiting for cures, and they can come with a huge proportion out of India. Thank you so much, and I'm more than happy to offer the sharing economy principle of Evotec to get in contact with all Indian companies where we could start and make things together happen. Thank you so much.